You are watching the DocTalk show.
So the other problem you can get is because of the pressure that is on the brain, this child is going to have difficulty in developing milestones. So their development is going to be poor. That's when you're going to find a child who is 2 years but can't sit, is 5 years but he can't walk. So there is an effect on the development.
On the way the child develops.
Yes.
They don't develop as well as the other children.
The normal ones. Then those that have developed and acquired the hydrocephalus, sometimes they regress, they grow backwards. It means the child could run, but now can no longer run, can no longer sit, can no longer support the head, so they deteriorate in the milestones.
Development.
Yes.
Yes.
Okay. Maybe just to add on to the point of development, we are the way we are because of the size or amount of brain we have. Okay? When a baby is born, they are born with, their brain is still immature. As they continue to grow through the years, the brain keeps maturing. So different parts of the brain mature at different rates. That's why a baby starts with just being carried, eventually they start to sit, eventually they start to crawl, because those parts of the body that are responsible for those activities are maturing. Okay? So now when there is pressure on the brain, development of the brain is compromised, and that's why the child does not develop the milestones. Now for a child who had developed milestones, if they develop the hydrocephalus later, then the pressure begins to the water begins to compress the brain that has been developing, then they fall back in their development.
And that would be why the development, what you call the development milestones.
Yes.
Yes.
They
So
now
they
feel like they are
regress.
going backwards.
So a child who had
instead of
started
going
walking
forwards.
along things, eventually will start just sitting. Eventually they will even stop sitting.
They prefer
because
to sleep because
yes.
okay. So could there be any other complications? So I've looked at the head size increasing, we have problems of growth and development. Any other problems that could come due to this?
Other problems can be from what Dr. Mlonda said, the brain controls many of the things that we do. So if there is pressure on the brain, it can affect some of the functions that we do. For example, speech. You'll find babies who can't speak with hydrocephalus, meaning the part that controls your speech was affected by the pressure. They can't walk. They maybe have weakness on one side of the body. Some may not control the urine. And cognitive functioning is sometimes also impaired. These children don't perform in class like any other because of that pressure that was on the brain.
I think, yeah, so we're kind of focusing a lot on children, but these complications can as well occur in adults, although you won't see an increase in the size of the head, but most times the adults will complain of persistent headaches. They might have problems with either their vision or their understanding. These are all signs and complications that the pressures within the head are building a lot. And if they're not attended to very fast, it could result in unfortunate instances such as permanent brain damage or even death because of what they call when the brain now goes through parts where it's not supposed to pass. So hydrocephalus per se is really a very big problem.
Yes.
It can occur in both children, can occur in adults. It has so many causes. And some of the most common causes for children is said sometimes it might be
Infection.
something within the brain, a congenital problem.
Yes.
Or it might be an infection acquired during the time when the babies are still in the uterus. Or it can occur later in life from, again, infections such as tuberculosis or meningitis, can occur from trauma, or it can occur from things such as brain cancer.
Tumors.
Yes. This hydrocephalus, we know in adults can become a medical emergency because of the excessive pressures within the head. How exactly do you treat this problem of hydrocephalus?
I should add that even in children it can be an emergency.
Even in children it will be an emergency.
There is an expansion that the head can't go beyond. So sometimes it can come as an emergency.
Okay, so thanks for that clarification. The emergency can occur in both
in both adults and
children.
pediatrics.
Okay.
But treatment is there for this condition, but the treatment is tailored according to the cause. So like we alluded before, there are causes that can be removed. For example, if the cause is a tumor, you go and remove the tumor, which will now allow the water to flow. But then there are causes that we probably can't, like infection we talked about. There are those, like in adults, they'll come in with active infection like CCM, cryptococcal meningitis, TB meningitis. You treat the cause. But in our experience and practice, we find these children come when the infection happened in the first 1 month, and the child is presenting to you at 1 year, meaning you don't have active infection in the head. You have the remains or the consequences of the infection that happened, meaning this infection went and blocked the path for the water. So what we do is to create an alternative path for the water, such that this water stops accumulating in one place. It starts to move like any other normal person. So that is the treatment that we give.
And that is a specific surgery.
Yes.
Causing another channel for the water to pass.
Yes.
And Dr. Ronnie, this surgery of causing another channel of water, how exactly is it done?
So the surgery, there are two forms of surgery that can be done. You can either put a shunt, and the shunt is also an alternative path for water. It's the one commonly done.
What is a shunt?
So a shunt is a plastic tubing that they use to connect, to move water from the channels in the brain and take it to other places in the body where it can be absorbed. For example, direct it into the baby's abdomen. So they put it in the brain through a hole and then pass it under the skin all the way into the abdomen. And so this water is being drained from the channels in the brain and taken to the abdomen where it can be absorbed.
Okay, so this this shunt procedure, I think, is it the most common procedure done?
It was until a few years ago. One of the things Cure Children's Hospital of Mbale is known for is for an alternative to a shunt. It was through research, it has been discovered that a shunt works, but it has many problems. It can block at any time. It can get disconnected. The segment in the brain can get disconnected from the segment in the abdomen. And once that happens, it becomes an emergency. And given the situation in Uganda, we have very few neurosurgeons, let alone places where people can actually operate on these babies. So in Cure, Cure developed another alternative surgical procedure called the ETV, or endoscopic third ventriculostomy. So what they do is they use a camera, go into the brain, look for one of the channels of water called the third ventricle, and look at the base of that channel and drill an alternative hole through which this water can pass, bypassing the initial blocked channel, now using this new door to go to the rest of the other areas of the brain so that it can access absorption. It can be absorbed.
So, and you say that these two surgeries, using the shunt, which is a plastic tube, and this new method of creating new openings deep within the brain can be done at the specialized hospitals. So please continue watching the DocTalk show, don't go away, and send in your questions and responses to our social media platforms.
You are watching the DocTalk show.